saying what is resonating with you in this conversation so far, but I'm going to jump the gun just a little bit and tell you what resonated with me on that last discussion, and that was the word avoidable. That was something right out of Daryl's mouth right away, and I'll just put that word on the table and see what you think.
I honestly think that avoidable is a place to start, but then we have to think about what are the barriers. And one of the things that I don't think has been touched on is medical mistrust, right? So the clip of people in the barbershop, you have to meet people where they are, and why are people willing to share things in the barbershop but not in the medical offices? And I think some of that is mistrusting the medical community.
So this is not just a socio-economic issue, this is a cultural issue?
Well, it's an and, right? So that they're intersections.
Right, so it's not only cultural, socioeconomic, but it's also structures, right? So it's power, inequality, structural racism. And as a political scientist and someone who is not in the health field, but just thinking about how discrimination and oppression are magnified. So it's a triple fold, right? It's not just that people don't trust doctors, but we have to think about like the Tuskegee experiment, right? And I don't think that was brought up in the other panel, where studies were done on African-American men and women, well, the women inadvertently, because men were going home not being told that they were infected with syphilis and sleeping with their partners. And this happened over a period of years that made African-Americans continually distrust not only just health professionals, but just think about the United States government, right? Not protecting African-Americans. And when we think more specifically about health experiments done, particularly on women of color, laws that say that if women of color poor women in general, if you want to access welfare, you need to be sterilized, or you need to be on birth control that is permanent, like so 5-year birth control, 6-year birth control that reduces your chance of having a child. So it's more than just distrust, right? It's kind of what does our government do that creates and manifests this distrust in African-American communities?
I definitely agree. There's a serious issue with trust, and I think what we need to do is to make, I think everyone trusts physicians more, is to make healthcare more approachable. You know, healthcare is scary. You go into your doctor's office, and if you don't know the things that they're mentioning, you don't know the drugs they want you to take, you don't know the diseases they're naming, that can be really terrifying. You don't know what you're approaching. And so I think we need to start early, and in elementary and middle schools, let's teach healthcare more. You know, let's teach kids a little bit more about chronic diseases. You know, I was very fortunate to go to a great public school in the St. Louis region, and let me tell you, my health class was a joke. You know, the school was great, but the health class was not taught by one of the science teachers, it was taught by a gym coach. And it was very clear the approach was, you know, we don't really care about this that much, we're meeting a state requirement. I bet I probably learned more about volcanoes than I did about health throughout my education.
You know, you mentioned something there in education. I think medical education is also a place where we can be educating our physicians and our healthcare practitioners, because to even know that history of mistrust, and to understand what you might be up against and how you can possibly reach different patients, because that's really important, to just not assume that all health professionals, you know, have the ability to interact appropriately.
I agree.